Hi everyone, it's me, Dr. Joanne, and today I'll be talking about fever in children. Fever is one of the most frequent reasons why parents bring their child to see a doctor. There must be a reason why fever in children is feared so much, and I guess probably these few myths have been adding anxiety to parents as well. So now let's take a look at these few myths with regards to fever. Myth number 1. A body temperature of more than 37 Celsius is a fever. Now that is not true. Our body temperature is not static. It ranges from 36.1 Celsius up to 37.2 Celsius. There are many factors that can influence our body temperature. For example, if you've been outside in the hot afternoon for more than 30 minutes and measure your temperature soon after, you will notice that your temperature could be slightly more than 37.2 Celsius. But does that mean that you have a fever? The answer is no. Our body temperature also has a diurnal variation whereby it tends to be highest in the late afternoon and in the evenings. And this could be one of the reasons why parents often feel that their child has a fever in the evening rather than in the morning. So what is the true definition of fever then? A fever is a temperature which is more than 38 Celsius. Of course, there might be variations depending on where you measure the body temperature. Myth number 2. Fever can cause brain damage and fits and can affect my child's brain development. Now this has got to be one of the biggest misconceptions ever. Now fever is a protective mechanism. When your child has fever, it means that his immune system is well functioning. Fever is not exclusively just because of infection, but can also be caused by other things, for example, inflammation in burns, or it could be a sign of underlying malignancy, cancer, which is relatively very rare in children. Now, fever tells you that something is going on with the body. In certain individuals, for example, children who are immunocompromised, either those who are on long-term steroids or those after chemotherapy, their immune system are basically suppressed and they cannot even mount a fever even though they are feeling unwell. Now that is even more dangerous. Now when we talk about febrile fits, not every child develops febrile fit. Only less than 5% of the children population do develop fitting episodes whenever they have high temperature. These fits are usually self-limiting and will stop spontaneously before 5 minutes. It does not cause any permanent damage to the brain, nor does it increases the risk of child to have further epilepsy in the future. And most of the time, as the child grows up after the age of 6 years old, these episodes of febrile fits are rather uncommon. Myth number 3. Fever should go away immediately after fever-reducing medicine has been served. Now, fever-reducing medicine such as paracetamol or ibuprofen is given not to reduce the fever so much, but to relieve the discomforts which are associated with fever. Now, these discomforts can range from having muscle aches, joint pains, headache, or just the general feeling of being unwell. Hence, if your child has a fever of 38 Celsius but appear rather comfortable, it is not necessary to serve the fever-reducing medicine at all. Fever may come down after serving these medications, however, it may not disappear immediately. Myth number 4. The higher the fever, the more likely it is a bacterial infection. The temperature of fever does not correlate with the underlying severity of the illness. Both bacteria and viruses can produce high spiking temperatures in a child. However, for children who are less than 3 months of age and those who are immunocompromised, bacterial infection should be one of the main diagnoses that has to be excluded when a child of this high-risk group are unwell. Myth number 5. Antibiotics is the best cure for any fever. If you come to see me in my clinic, you will realize that most of the time it's very hard to get antibiotics prescription for me. Mainly because when we look at clinical studies or even in the clinic when we do blood tests on children who are unwell with fever, about close to 80 to 90% are due to viral infections and not bacterial infection. Antibiotics, once again, only work against bacterial infection. If you take it for a viral infection, basically it might do more harm than good. So that would unnecessarily cause antibiotic-associated diarrhea in your child, and the intake of antibiotics also has been proven to increase the susceptibility of getting infections in the future as it affects gut health. And not only that, there is also a slightly risk of allergy, especially if these antibiotics were introduced at a younger age. If you have any doubts, whenever your child is unwell, feel free to contact me either on my Facebook Messenger or through telemedicine via G Health or even BookDoc. Bye-bye.